Welcome to the COVID-19 Global Conversation Series, hosted by the Henry M. Jackson School of International Studies at the University of Washington in Seattle. Thank you for joining us. My name is Sunila Kale. I'm an associate professor in the Jackson School and director of the South Asia Center. And today I'm in conversation with Mukta Naik from the Center for Policy Research in New Delhi, India. Mukta is an architect and an urban planner whose research interests include housing and urban poverty, urban informality, and migration. She's joining us today from her home in Gurgaon, just outside of India's national capital. Due to our format and some time considerations, you can find a link to both of our full bios on the webpage that's hosting this series. Thanks very much for agreeing to speak with me, Mukta, and for being so flexible in finding a mutually convenient half hour for this discussion despite our 12-and-a-half-hour time difference. I'd like to ask you a few questions that start at the more general level and then move quickly to your specific areas of expertise and concern. So to begin, can you describe the emergence of the disease in terms of its timeline, its progression, the regional spread, and public health predictions of its severity in the Indian context?
Thank you, Sunila. Thank you very much. And this is a great opportunity. I think I'd like to sort of go back to the end of January at the time that the WHO was sort of looking at the novel coronavirus as a global health emergency. This was about the time that India was reporting its first case down in the southern state of Kerala. And these were people who had actually come back from Wuhan in China. So there was sort of a direct spread at that time and then a growth. And Kerala was able to deal with this because they had an epidemic of the Nipah virus in 2018 and actually had already put in place contact tracing and quarantining protocols at that time, which they were able to deploy quickly for this. But by 11th March, so between end of January and 11th March, when WHO actually declares COVID-19 a pandemic, India had about 50 cases, and shortly after that, its first death. And so that's when the attention on COVID actually starts growing in India. At this time, just for comparison's sake, Washington State has 374 cases and 31 deaths. So that's sort of the comparator here. So it's only in mid-March that the epidemic sort of starts becoming real to Indians and people start talking about it and the media starts covering it and the anxiety around it starts growing and the Indian government declares it a notified disaster in mid-March with 84 cases and 2 deaths at this point of time. But all these cases have, all the positive cases have a direct travel history from countries which are already global hotspots, or they are directly in contact or related or living in the same house or working together with these red cases. So all of the focus from a public health perspective, it continues to be at this time on contact tracing and quarantining. And that's sort of, it's not still being looked at as something that could potentially spread, to low-income and highly dense communities, which of course was a big concern in India right from the beginning. However, in the week following this, the cases did begin to grow and the anxiety did begin to grow. So on 24th March, we went into a full lockdown in India. Lockdown essentially was expected to contain this period when the maximum spread would happen. And we've been in lockdown for 5 weeks now, and the cases have risen exponentially despite there being a quite stringent restriction on mobility across the board and a complete seizing of economic activity. So anything except essentials, everything except essentials is closed. As far as statistical models are concerned, there's been a huge variation in late March. 2 different models that I referred to, sort of just to give an idea. One predicted 300 to 400 million people getting the virus, and another one predicted that by mid-May, about 13,800 people would get the virus if stringent measures were in place, but we've already exceeded it. So as of 27th April, we are at 21,632 cases and 900, and so almost we're reaching the 1,000 mark on the deaths. So it's neither here nor there. I mean, there are these large predictions for a country like India, but on the other hand, we've already exceeded the conservative predictions. And as of now, the official line, or the central government's line on this is also not very clear. So there are 2 different estimates going around. So there's one line that says that we're not going to have any more new cases beyond mid-May. And there's another line that says that we're going to have over 650,000 new cases in Mumbai alone. So the variation is huge and it's not very transparent and I think evident to the public what the government's line is on how how the disease is going to actually spread. So that's sort of where we stand. And at this point of time, when we are preparing to come out of the lockdown in some sort of a graded fashion, I think the fear is that once that starts happening, we will actually know the reality of this. That's where we are now.
That's really helpful. Thank you so much for sharing all of that. I want to pick up on something that you just mentioned, which is the government's response. As you said, it's quite stringent in India, especially compared to other parts of the world. So could you talk a little bit about the main effects of this response, the government response, both intended and unintended? Who is being impacted and how?
So we've had two sort of consecutive lockdowns from 24th March to 15th of April, and then extended again to 3rd of May. So, and I mentioned that although they were contiguous, I mentioned them as two separate lockdowns because of the kind of expectations and anticipation that it set off among people. So, these lockdowns basically were implemented under the National Disaster Management Act, which actually gives the central government and the Disaster Management Authority powers to pretty much override existing laws, to have states comply with whatever they put out as orders. So it's, in a sense, becomes a fairly centralized, top-down kind of a way of managing this lockdown and the crisis. On the ground, of course, the crisis management is as good as the implementation capacities of local governments and district governments. And the district is sort of the unit that is below, the administrative unit below the state in India. And so for ordinary people, the lockdown is very much akin to a curfew, which is basically a restriction on mobility and restrictions on gathering that people would otherwise have experienced if there was communal tension or riots or this kind of a tension. So it's the experience of the common person has really been the police as the arm of the state that is visible and implementing the lockdown and sort of going around with megaphones and telling people to stay home, because the reality of the country is that many people are living, especially because the cities are the target of this disease, are living in crowded, dense localities where social distancing and all of this is really a theoretical, it's not even an idea that they can consider because they're living in very congested quarters. And so this lockdown really becomes the police coming in telling you can't get out of your home, which is one room which you're sharing with 7 other people. So, the idea of locking down a country to prevent disease versus the lived reality of actually experiencing that lockdown is quite varied. So right now, the unintended effects have obviously been sort of resulted in this lives versus livelihood debate. That's how it's being sort of looked at right now, because the majority of India's workforce works in the informal sector, and the informal sector itself is very varied from people who work without contracts to a large number of small entrepreneurs, small businesses, domestic workers, industrial workers without contracts. So none of these people actually got paid. So as soon as the lockdown hit and economic activity ceased, they had no savings and nothing to fall back on. So the unintended effects of the lockdown actually became visible when the images of migrants walking home hit screens, when large-scale deprivation and hunger, the reports, SOS calls started coming in at the local level, and civil society had to respond in a situation where they were not physically free to actually go and get out of their homes and provide that aid. And so it became very complicated to manage these unintended impacts of the lockdown. So the critique has really been that there could have been some anticipation of this, but the reality has been that didn't happen, and now there's been a flurry of responses to this situation.
So in this context, can you talk a little bit more about your own ongoing research as well as community engagements? Because the topics that you deal with centrally are migration and urban informality, which, as you've just mentioned, have become so crucial in this moment.
Yeah, so I'm trained as an architect and planner, and at the Center for Policy Research, we do a bunch of interdisciplinary work broadly on issues of governance, mobility, service provision, and increasingly actually on questions of livelihood and how that connects with all of this. So, for example, I've recently looked at something at a project in which we look at small cities as sites of aspiration for young migrants. And again, in this conversation, smaller urban areas in the COVID conversation have got a lot less attention than hotspots like Delhi and Bombay and Hyderabad, where the numbers are very high. So that's sort of the unevenness in terms of also our knowledge of what's happening with the disease, as much as it is a disease of density and of larger cities. In another project, I'm looking at landlord-tenant relationships in informal housing, and that again has sort of factored in here because reports of rent extraction at a time when people don't have savings and cannot dip into any sort of savings that they might have in another location is actually exacerbating their distress at this point of time. And it has, because of the informality of the housing market, housing rental market, it's not possible for the government to actually step in and say things like, don't charge rents for the next 3 months. It's really not effective to do that because it boils down to the relationship between the tenant and the landlord, and each negotiation works in a different way. So that's how the informality actually plays out on the ground. In our own work, I've been looking at, of course, following the response of the government and the civil society to the hunger crisis. That's been a thrust of my work. And in Gurgaon, where I live, I'm involved with the civil society initiative here to actually get ration kits and cooked food out to clusters of the urban poor. And what's been fascinating is that these people were actually quite invisible to the local state until this happened. So they knew they were there, but to have a handle on the numbers, where these populations are concentrated, and the actual differences between the kind of precarities that different populations have, this is not data that the government already had to run with. So you're actually collating data at the same time that you're bringing solutions to the table. And that's really stressed the capacities of local governments who are already very, very stretched and are not very high on capacity in the Indian context, especially in urban India. So that's sort of been the thrust of the work in terms of working with local government and local civil society to find solutions that work. And conversations that we've been having for a very long time, for instance, universalizing social protection, especially access to the public distribution system through which people can get subsidized food and essentials. We've been talking about this as policy researchers for a very long time, but in this moment, states have had to operationalize and create special emergency windows to distribute rations to people who don't have the right identity cards and the right registration papers and all of that. So it's an opportunity too, in a sense, to demonstrate to the state that things are possible that have sort of been considered very difficult to do in the past.
So can I ask you a follow-up to that, which is, you mentioned the real problem of a civil society response in a regime of immobility. And you've also mentioned the need for civil society to engage with the local state and to kind of demonstrate to the local state that it has perhaps pockets of capacity that it maybe wasn't even aware of, right? That things are possible. So how does civil society maneuvering in this space? It's not, people aren't able to move freely, and yet there is some movement that's required to serve communities who are in need.
Yeah, so I think that's really the strengths of the relationships and the embeddedness that already pre-existed. So in India, a lot of the last mile delivery of social services is already happening through civil society. So places that had very embedded civil society were obviously able to get further, faster with relief than others. Like, for example, in Delhi, I think when the distress ration coupons were opened, and this was an online system, which a lot of poor people find hard to fill, civil society filled that gap in very quickly by helping people fill online forms. They had connections to be able to get curfew passes, which enabled them to move around. So there was a lot of that happening. But at the same time, because of the top-down nature and this use of this National Disaster Management Act, which is set up in a very particular way, civil society also has to be very careful about how they respond to this. So they need to help, but they are not encouraged to critique at this point of time. So it becomes difficult to negotiate. It's a tight space within which, so you're expected to help, but you're not expected to tell the government where things are going wrong. I think in some states that relationship existed from before to be able to collaboratively build solutions. In other places, that relationship is being negotiated right now under these circumstances.
That's really interesting. I realize that for listeners who are not so well versed in the Indian context, they might need a quick primer on the ration card, the idea of a ration card, if you want to describe it.
Yeah, so essentially the public distribution system gives out grains to people who are eligible. So there are some poverty parameters that you have to meet. However, this ration card is an institution that kind of also proves your residency or your citizenship status in a local. So it's a location-linked service. So you have a ration card in XYZ locations and you can access rations from a particular point of sale or point of distribution that the government assigns to you. And what we've been asking for is a portability system by which migrants who move from one part of the country to the other can use their ration cards irrespective of where they go. And that's really been hard to navigate because there are no interstate coordination mechanisms and fiscal mechanisms to make this happen. And that kind of policy work is also something that CPR and a number of other institutions are now very quickly trying to do, to say, how can the center actually quickly put in place these systems to make this happen?
So we have a little bit of space to talk about how researchers like your colleagues at Center for Policy Research are able to. So you mentioned that there's a very, very tight space, that one can't be too critical, and yet in offering assistance, in some way there's an implicit observation about what is lacking on the part of the state when you're offering assistance. So how what are the channels by which civil society is able to negotiate those? Are those also built on the sort of social relations that cross between the state and sort of elite actors in society?
Yes, definitely. The social relations are important, but as a policy research institution, I think some of those relationships already pre-existed. So the kind of things that we were able to do is sort of just going back and listening to the experiences of the communities we already work with. So migrants, homeless people, sanitation workers, and these are very specific kinds of constituencies. And even if you can't physically go there, if you have strong field connections, it's possible to get some on-ground view. And at a time when the state is trying to do so much, sometimes just putting these views out as is without necessarily sort of adding a layer of analysis to it in itself is also an important contribution. So that's something that a lot of organizations have been doing. A second set of contributions is along data analysis and modeling. And so modeling of mobility scenarios, testing scenarios and strategies. So that kind of data work, which a lot of organizations are doing, and everybody brings different capacities and interdisciplinary approaches to this. So while the data scientists and the epidemiologists are doing certain kinds of modeling, I think social scientists are doing, and public health, people are doing different kinds of models. And I think that is an interesting debate to sort of open out the possibilities here. And a third group, of course, is people who are doing purely policy work, like I mentioned, with the redesigning of the social protection and the fiscal architecture around it. So that's another kind of work that is being done. And much of it is, yes, being done through pre-existing channels of work with the government or with multilateral and bilateral institutions.
So let me end by asking a sort of more expansive, somewhat speculative question, which is, how do you and your colleagues reflect on the post-COVID world? So are there features of India's politics and social norms that are likely to be altered, either in the short term or even more permanently, by the events of this year?
Socially, I really doubt if a month or two of lockdown or the immediate fear of a disease will have long-lasting effects on how people behave with each other in a civilization that's sort of very old and has a particular set of social norms. So I think we'll wait for that to play out. There isn't really an even perception of the disease across the board in a country as diverse as India. And while there has been a lot of stigma attached to COVID patients, like we've seen in HIV before, these things tend to pass over and life kind of goes back to normal. So I'm not a big believer that we'll have a huge social change, because things like social distancing are really alien to a lot of people in this country. And I don't think it's something that they're going to really take to heart and change in their day-to-day lives. In terms of the political moment, again, there's been this whole talk in India too about whether we could leverage this crisis to reset the world and sort of make it more sustainable. But personally, I don't think we have the leadership to make this happen. In fact, it's alarming that the government right now is sort of passing changes to environmental legislation during the period of the lockdown, and at a time when environmentalists can't really do much to oppose or to create a public debate about something when the news is sort of chock-a-block with COVID and its related aspects. So this is sort of where we are right now. I think it's easy to be cynical on a political level, but I also think hardships can do interesting things. So I think we'll have to wait and watch, in the sense that, just to explain, I think this heavy-handed implementation of the lockdown has a lot of popular support in India. I think people are quite convinced that this was the only way to manage a disease, and the analogy of war that's been consistently used by the leadership has really hit home. However, citizens have been infantilized in a particular way. They've been told what to do, how to do, when to do what, all of that. And it has become a lives versus livelihood debate, not just for the poorest of the poor, but for a lot of people. People are staring at pay cuts and job losses, and small businesses are going to go under. And so as the reality gets closer and closer to people, we shall have to see whether that sort of overall support to this move will shift a little bit. So it's early, I think, because we're still expecting that post-lockdown, the cases will likely increase, and the statistics will sort of change the public mood in particular ways.
You mentioned in your remarks that there is a sort of stigma attached to COVID positive people. And I've been really struck by the news coverage of the stigma attached to healthcare workers, frontline workers, nurses and doctors, which, is a profession that was traditionally accorded a great deal of respect, those fields. And so I'm wondering if you have any thoughts on that, on how to make sense of that.
I think there was already, even before COVID struck, the last few years have seen a lot of attacks on doctors and nurses. And so there's been something in the public discourse, which it's something to do with how healthcare has got privatized, how people are frustrated about not getting affordable healthcare. The privatization means it's more of a commercial transaction. So there's already this pre-existing shift in the narrative, and this has just come on top of that, I think. So I wouldn't treat it as specific to COVID as such. But of course, the stigma of COVID and the way it's been portrayed, like we've seen before in other infectious diseases, especially in the case of HIV, has added a sting to that whole process. Yes.
So thank you so much. This concludes our program. Thank you, Mukta, for joining us and for sharing your insights and expertise. Thanks to those listening and for joining the Jackson School's Global Conversation Series. And if you'd like to learn more about our online events or programs, please visit our website, jsis.washington.edu. Thank you all.